So in this video, we will tell about the histology of the CVS. Okay, all histology of CVS. So in histology, there are now, first of all, we will discuss the circulatory system. What is circulatory system? Circulatory system have one lymphatic and another is the blood circulatory system. These are two circulatory system. In blood circulatory system, there is a microvasculature. Okay, consists of arteriole, capillaries, and venules. So in the diagram, you can see this is the arteriole. Okay, uh, arteries, arteriole, and between them there this is the capillaries, and after that this is the venule. Okay, so now you can see that this is the capillary, and in capillaries there is exchange of gases, nutrient, metabolic waste are occur. Okay, and this is actually the sphincters. After the arteriole there is a pre-capillary sphincter that control blood flow into the capillaries. If there are more blood flow goes to the capillary, there are more exchange occur. Okay, just like this. Now there is the arteriole. Now we will discuss the histology of arteriole. So in arteriole you can see this diagram. Okay, in this diagram you can see the outer layer is called the tunica externa. Okay, it is surrounded by fibrous tissue. It is surrounded by fibrous tissue, and the middle layer is called tunica media. It consists of 1 to 2 layer of smooth muscle, 1 to 2 layer of smooth muscle. Okay, and the inner layer is called tunica intima, and tunica intima consists of middle layer consists of smooth layer. Okay, and the intima consists of internal elastic lamina and endothelial cell. This is the endothelial cell. Okay, this is the endothelial cell, and it consists of rounded nuclei. Okay, so it is about the arteriole. Now we will discuss about the capillaries. Okay, so coming here to the capillaries are smallest in diameter. First of all, the second thing is actually this is the capillary. Okay, and this is the basement membrane of, if you see this is the about the same as RBC diameter. If you see the RBC diameter are same like this. Okay, the next thing is called is there is the endothelial cell. Endothelial cell are present here. Okay, now if you enlarge this area, there is a pericyte. Okay, and pericyte cells, and pericyte is actually supportive structure. Okay, that are called pericyte. Supportive structure are called pericyte. Now there are three type of capillaries. One is the continuous capillaries, the second is the fenestrated capillaries, and the third is the sinusoidal capillaries. Okay, so we will tell about the continuous capillaries. What is the continuous capillaries? Okay, so in continuous capillaries you see that there are many tight junction. Okay, that the endothelial cell have many tight junction. Molecule or protein layer are entirely regulated by endothelial cell. For example, here the exchange, all the things, here the exchange etc are regulated. Okay, another is the sinus, second is the fenestrated capillary. So fenestrated capillary have also tight junction, but perforation fenestrated 60 to 80 nanometer have fenestration through endothelial cell. If there are endothelial cell, okay, if there is endothelial cell, in that endothelial cell there is a fenestration. In this fenestration they can move in and out. Okay, and that's why it allow exchanges. And another is the it is present in the endocrine gland, intestinal, and choroid plexus. Okay, and also in the peronocytic area. Now the third layer, the third is called the sinusoidal capillary. Sinusoidal is present in the liver. Okay, and break in both endothelial and basement membrane is also present. Another is the allow more exchange of nutrient. Actually sinusoidal capillary have allowed more exchange. Okay, more exchange of macronutrient and decrease control regulation. Here are no more control regulation, and actually large diameter 15 to 30 nanometer. So this is about the arterioles and capillary. Arterioles. Now come here, and after that this is capillary. Now explain the structure of capillary. So this is the post capillary venule. Okay, this is the post capillary venule. After this is the post capillary, so it have large lumen, no smooth muscle. When these post capillary venule combine, they form a collecting venule, and collecting venule combine, they form a muscular venule. So post capillary venule and muscular venule, collecting venule and muscular venule. So collective venule consists of large lumen, no smooth muscle convergent into smooth muscle. Smooth venule, and smooth venule have 1 to 2 layer of smooth muscle. So you have to understand first of all post capillary pre post capillary venule, then it combine form collecting venule, and then it combine form smooth venule. Okay. So now we will discuss about the histology of the venule. So we have discussed the histology. Okay, now the remaining histology is about the arteries. Okay, we have discussed the arteriole and venule. Okay, and capillaries. Okay, now we have tell about the artery and vein. So first of all, you have when artery come, they form capillaries, and capillaries combine they form veins. Okay, so just like this. Now see there we have discussed the artery, we will discuss artery and vein. So this is the diagram of the arteries. Okay, this is the diagram of the vein. Okay, so first of all, both of them have external layer, and this is the external layer. Okay, this is called tunica adventitia. But the tunica adventitia when have large lumen, thickest layer of adventitia. When have thickest layer of adventitia. Okay, and artery have thicker media. Actually, artery have media are thicker of the artery. Okay, and smaller lumen is small. When have large lumen. Okay, but the adventitia is thickest. The other thing is longitudinally collagen elastic fiber are present in both of them, actually in the tunica adventitia. Now the middle layer is called tunica media. Okay, in this middle layer there is the smooth muscle. There is actually the smooth muscle is present in the middle layer. And after that, and you have to remember that the media is thicker of the artery, and the vein media, tunica media are not so much thicker. Another thing is the external elastic lamina is also present in the arteries. Okay, if you see here, this is the tunica intima, tunica adventitia, tunica media, and tunica adventitia. The inner layer is called tunica intima. Okay, actually there are one of thing is the endothelial. One is the endothelial tissue, another is the subendothelial tissue. Endothelial is actually semi-permeable membrane. Okay, and the subendothelium tissue has loose connective tissue. First of all, it have loose connective tissue. Another thing is it is a smooth muscle. Okay, smooth muscle long, and another is the internal elastic lamina is also present. For example, this is the internal elastic lamina. This is the internal elastic lamina present in it. So internal elastic lamina is present in it. So you have to remember this, the arteries and about the veins. Okay, now the second thing is we have to tell about that is the one is the large artery and one is the large vein. Okay, so first of all we will discuss the large veins. Okay, large vein have one is the thinner wall compared to large artery. It have thinner wall compared to large artery. Larger artery not well defined. Large artery have not well defined walls. For example, well defined thickest layer. Okay, tunica adventitia. This is the tunica adventitia, and in the vein the tunica adventitia have thickest layer. You have to remember this thing. Abundance, because it have abundant smooth muscle and abundant collagen fiber. Okay, and if you want to stand this may be a eosinophilic and basophilic, because smooth muscle are present in it. Another layer is the tunica media. Okay, followed by after the tunica adventitia there is the tunica media and tunica intima. Tunica media have much thinner compared to internal elastic arteries. Okay, actually the vein media is thinner. Vein media is thinner than the artery media. Okay, and it have 2 to 3 layer of smooth muscle, just like this is the first layer, this is the second layer, and this is the third layer. Third layer have tunica intima. Actually it have a folds. Okay, to allow flexibility. So vein are more flexible. Actually vein are more flexible if you increase the pressure, so it can be folded. Another is the tunica. This is, so if you see, this is the tunica intima. Okay, internal layer of tunica intima. Here is the folds are present here. Now, so we have discussed the venule. Larger and medial vein. Large and medial vein both have no external elastic lamina. You have to remember this point, that you have to remember that both the large and medium vein have no external elastic lamina. Now the second thing is about the large artery. Large artery, one thing is the it is actually large artery have elastic arteries, are actually elastic arteries, are muscular artery. For example, aorta, carotid artery, these are large artery, and muscular artery are femoral, radial artery are muscular artery. So large artery are two. One is the elastic and second is the muscular artery. Elastic artery are aorta and carotid artery. Muscular artery are femoral and radial artery. Okay, diameter of the elastic artery is greater than 10 millimeter. Okay, and the diameter of the muscular artery is 1 to 10 millimeter. Another thing is the more there are in large artery there are more elastic fiber, but in the muscular artery there is more layer of smooth muscle. Here is the smooth muscle because in the muscular artery there are contraction, etc. Okay, another point is the actually it have prominent internal elastic lamina. In the muscular artery the internal elastic lamina are more prominent. Okay, and now first of all, if this is the carotid artery, so this is example of muscular artery. Okay, this is example of muscular artery, and you can see it, the in the diagram. For example, this is the muscular artery, you enlarge this, so this is the this is actually the tunica intima layer. This is actually the tunica intima. This is the tunica intima layer. Okay, and this is the tunica elastic lamina. This is the tunica elastic lamina layer. Okay, and between them there is the endothelium. Endothelium are simple specialized, don't have flat. Okay, because of folded, because it is not folded, because it is not flat, because it have folded, different folded. Tunica intima have small folded to allow to expand. Why it have folded? What the reason of folded? Because for example this artery extend like this, so after extension when they relax, so they, how can they decrease their size? So by folding. Okay, they fold, so their length is decreases like this, in this way. Okay, so the endothelium have don't flat, not a flat appearance. Okay, another layer is the tunica media. So you have to know that tunica media have concentrically arranged elastic fiber. Okay, for example there are concentrical arranged, this is like this, concentrically they are arranged like this. Okay, if you enlarge this from the side, so this is like this, this is the orange elastic fiber are present. Okay, and they stain with the aldehyde fuchsin stain. Okay, with special stain, that is aldehyde fuchsin stain. Another is the alternate with the smooth muscle, alternate of smooth muscle. Another is the chronic high blood pressure. For example, there is a chronic high blood pressure, so increase elastic lamina layer. There must be increase in the elastic lamina layer to compensate it. If there is a higher blood pressure, so the body, well, the elastic lamina become increases for to compensate it. If this not happen, so the blood pressure will be increases. Okay, in that person. Another is the tunica adventitia. So tunica adventitia, you see from here, this is the actually external layer and 1 to 2% thick of the wall. For example, this is the wall. Okay, so half of them is actually tunica adventitia, and most of the thickest layer of tunica adventitia is present in the veins. Okay, it has dense irregular connective tissue. Vasa vasorum mean vessel of the vessel. Tunica adventitia have vessels present in the tunica adventitia. Okay, another, it have also adipocyte present. Now we will explain the histology of MSK. Okay, cardiac muscle. So cardiac muscle have, one is cardiomyocyte. It's the cardiac muscle diameter is 15 to 30 micrometer. Okay, length is 80 to 120 micrometer. This is the cardiac muscle. Okay, another thing is the unique characteristic is actually it is branch cell, 1 to 2 centrally located nuclei. Another is intercalated disc is present in it. Specialized junction, it have specialized junction. Okay, between the neuron, that is called gap junction. Allows cell to have synchronized contraction. For example, if there are 1 2 3, 4, 5, 6, 7, 8. These are 8 cells. For example, a stimulus come here and this cell contract. So the all cell contract at the same time. This is called synchronized contraction. Okay. Another is the intercalated disc. Intercalated disc. Intercalated discs are present between them just like this. Okay. So it you can stand by H and E stand, but it have a specialized stand. If you use the specialized stand, this is H and E stand. Okay, if you use this, the intercalated discs are not so much appearance. Okay, it have thin, slightly darkened and perpendicular to the muscle. For example, this is the layer of the muscle. Okay, cells of the muscle, so they are perpendicular to this like this. Another is the lipofuscin. Okay, another is lipofuscin. So it is yellow brown new some nuclear residual of lysosome digest. For example, the residue of lysosome digest here. Okay, sign of wear and tear are also present here and accumulate with the age. With, for example, if the age increases, these residue etc are accumulated here. Okay, intercalated discs. For example, if you use the this is lipofuscin. Okay, lipofuscin are actually yellow brown and residual lysosome digest. For example, if lysosome digest something, these are present like this in the lipofuscin body. Okay, sign of, for example, these are, if this is more, this is mean that there are more wear and tear are happened here. Okay, another is if you use the intercalated disc as a specialized, this is a specialized text. For example, phosphate testic acid hemotaxylin PTAH. Okay, if you use this term, then you see the intercalated discs becomes 10 darker purple, so you can see it easily. Okay, so it is about the histology. We have explained all the histology. Now we will explain the physiology of the heart. Simple. Okay, in simple form.